Kia ora everyone. This video is in response to the position statement that the Epilepsy Society of Australia has put out in regards to sodium valproate use for women in childbearing age 2018. When we put the Facebook post out, it was interesting to see your responses, and we wanted to see your responses. Your responses were, it's appalling, it's disgusting, it's going back in time. Here at FACS NZ, we also have some areas that we would like to discuss a bit further. And so one of them is in regards to when the position statement says the use of sodium valproate over the past decade has changed dramatically with a decline in the dose and number of prescriptions in women enrolled on the Australian Pregnancy Register. It'd be absolutely fantastic if we had a pregnancy register here in New Zealand, but actually we don't. What we can tell you though is that in 2016, the sodium valproate was the second most prescribed anti-epileptic medication for females. And sodium valproate was the second most prescribed anti-epileptic medication for females in childbearing age in 2016. So we'd love to see a reduction in that, but that isn't the case. What we also know is that for some women, absolutely sodium valproate is the only choice of medication for them. So we're not saying that they should come off that medication. Quite the contrary, actually. We are saying that they should have informed consent. This is part of your health and disability consumer right, that you get informed consent. Informed consent does not mean that you get just little bits and pieces here and there. You get full informed consent, because only you will know what is your situation and what is best for you. Another area we would like to address is when they were talking about harmful overreactions. Now, we don't consider up to 40% of babies exposed to sodium valproate will have cognitive and or physical impairments and overreaction. This is research that has been done, and this is research that has shown this. It is not an overreaction. Actually, we would like the female to go and talk to her healthcare professional and ask the questions prior to getting pregnant. This is around pre-pregnancy counselling. However, we also know that there are women out there who accidentally become pregnant. And so it is important to know that information even if you're not considering becoming pregnant. So when we're getting told we're being overreacting or things like that, actually we're not. We're asking for informed consent prior to pregnancy, whether a pregnancy is planned or not. And also, when you're talking about that valproate, sodium valproate is the only medication that you can take or possibly take for an epilepsy, again, informed consent. We know that not all of the women taking sodium valproate will have a baby that is actually affected by this. We also know that there is a lot of women out there who do have babies who have been harmed by exposure to sodium valproate, but do not know their baby has been harmed. But what we are saying is actually do not come off your medication without speaking to a healthcare professional. It is vitally important you speak to that healthcare professional because they can give you the full informed consent. They can provide you with the risks and benefits. What we are doing is we are trying to give a balanced overall look. However, I'm just going to tell you about some of the stories of our own parents. Our own parents that have been affected by a loved one who has, for example, fetal valproate syndrome, or the effects of being exposed to sodium valproate during pregnancy. This time can be extremely difficult for them. They do not know what the future holds for their child, and this is extremely difficult. And so, it is very difficult for them to read a position statement like this, where you're saying, oh, stop overreacting, that's very harmful. Actually, you need to be considering those that have been harmed as well. And so we ask the Epilepsy Society of Australia, please consider those people. They have a voice. Our future generation that have been affected by this, they have a voice. So not only the women who have a child affected, but also those who have been affected. Now you're probably wondering, why does this even matter for us here in New Zealand? Well, why it matters is that the New Zealand League Against Epilepsy do not support the booklets that the FACS prevention team, the ACC FACS prevention team, have actually produced. And so they may not give you the booklet, and they may not give you all the full information. We are absolutely asking the New Zealand League Against Epilepsy to provide informed consent, full informed consent, and also give out these booklets. We want our women to feel empowered about making that decision with you, in collaboration with you. It is about a partnership where everyone has a voice. Equal partnership conversations. That's what we're asking for.